Welcome back, everybody, and I got Tiffaney with me. We're going to be talking about the roles of PCA, CNA here at the hospital, so let's get into it. All right, so this is Tiffaney. We've been working together for about 2.5 years, right, Tiffaney?
Yeah, about 2 years.
Yeah, so we've been working well together, and so she wanted to come on. She has a YouTube channel of her own, Walkwithme.tiffaney, and so she's going to be helping out getting more of that feeling of what it's like to be on the other side of the hospital care. So Tiffaney, tell me a little bit about your experience.
Well, I've been a PCA here at the hospital for about 7 years. I've been in the medical field basically since I graduated high school, and I've been out of school for about 20 years. So I do have a little bit of experience. You have to love the medical field. You can't just do it for a paycheck. You do have to have a lot of patience. We do a lot of physical work here, but it's well worth it. It really is at the end of the day.
So one of the things I did want to talk about when it comes to PCAs, as a nurse, I do rely heavily on the PCAs, and she can attest to that. A lot of the times with her experience, she sees the patients a little bit more often than the nurses do, you know, doing the vitals, doing the care and the cleaning of the patients, and just overall answering the call lights a little bit more often than the nurses do. So they see the patient, they get to know them, and when they see something declining, they usually refer that back to the nurses. They're the ones doing the vitals. They are quick with letting us know when there's something critical, and then it becomes my job to go and do the next step. So a lot of times I've had codes where they have started initiated because the PCA actually informed me that there's just something not right. So do you want to go ahead and elaborate a little bit on those experiences that you've had?
Yes, it's very important to have that connection with your patient. You have to learn your patients, know your patients. You can't be just doing it for a paycheck. Pay attention, because like you say, a lot of times we go in there and like the PCAs, we notice how a patient eats, or if a patient's been sleeping all day, or they're out of it, or they're feeling really nauseous or getting dizzy, weak. And if we pay attention to the vitals a lot too, because we do vitals all day. So, and we notice how the vitals, if they're changing, and to notify your nurse, and hey, I think something's going on. Even though I'm not a nurse, it's still important for us to pay attention. It's teamwork, and it can cost somebody their life if you don't really pay attention. We've had code blues, and people have seizures and everything else. And sometimes if you're on it, you can save someone's life.
So tell me a little bit about what it is in the day of the life of a PCA, and what it is that you love about the job, and a little bit of the stuff that you weren't really prepared for on the job.
It's a lot of work, you guys. We work 12-hour shifts here, so we're always constantly on our feet. I absolutely love what I do. It is a lot of physical work, but I really love it. You have to have a lot of patience, because you got to remember our patients are sick, and sometimes they're not happy. So we get called names, every name you can think of in a book. But at the end of the day, it's worth it to save a life, or to possibly put a smile on somebody's face, even if they don't smile. Just knowing that you're helping that person, and help saving their lives, it's all worth it.
So there's a lot of duties that the PCA does, and when it comes down to it, it's not just the vitals, and it's not just the cleaning. What are the other duties that you do?
Besides the vitals and cleaning, we assist with feeding, to ambulate back and forth to the restroom, be a listening ear.
And that's really the most important thing when it comes to patient care. A lot of times the doctors aren't there, and the nurses are there a little bit more, but the PCAs themselves really allow that extra emotional attachment that the patient really craves and needs at a time of healing. And that's really a big calling for the PCAs that we see. They'll sit in the patient's room a little bit longer. They get that personal connection. And when you see that smiling face when they come in the mornings, and it kind of will change the atmosphere. When they said, a lot of times I get a lot of compliments from my PCAs by the patients on just how helpful they are, and just how much caring that they receive by the PCAs. And that's that's something that you can't put a price on of healing when it comes to the hospital care. And that doesn't go just for hospitals, that also goes for nursing homes, that goes for anywhere that you'll have a care where they are there with you, pretty often. So those times that are coming with the vitals, those times with the feedings, getting those trays together and everything about that, we rely heavily on them to actually give us more data, to really push forward to giving our care and our direction for the patient.
And we basically become like second family to some of our patients and stuff. Like, we got to remember that they're away from home, they're not feeling good, they're scared. So, it makes me feel so good when I can be that shoulder to lean on and to encourage them to keep it, to keep their head up. And they become like family to me, and we get that connection. Even though some of them aren't here that long, it's just worthwhile at the end of it, being able to be there for our patients and make them feel better. Even if they're in a lot of pain, sometimes just what we think might be so small is so big to them. Just being that listening ear and comforting them. That's what makes me happy.
So for me, I know as a nurse, sometimes some of the PCAs get annoyed with me because I'm kind of slow in comparison. Sometimes I try to help fill in and maybe changing a patient, and they're there helping me, and I'm trying to clean them up, and it just seems like I'm taking forever in comparison to them. They're super experienced. They know what they're doing day in and day out. And for us to go in there and try to do their job, sometimes we're just not as efficient as they are. And I think for being a new PCA, that can kind of be a little bit more daunting, looking at some of these PCAs that have been very experienced, and they can go through those vitals, they can go through those baths, go through everything, changing the bedding, the linen, and everything, and just turn around so fast that they've had so much experience, and you're over here struggling just to keep up with them, and that's a huge testament to just how well they've been doing it, and they've been doing it for so long that they can allow for more time for that caring feeling of those patient care.
Yeah.
So what are the kind of things that you learned from more experienced PCAs when you first started out being a PCA that you would want to give to a new PCA?
We have a lot of older PCAs here, and they have taught me so much, and I thank God for every last one of them. And some of them are a little bit, you might think, oh my gosh, they're so strict. They're not. They're very professional. It's just because they've been doing it for so many years, and everything that they teach you is they're teaching you because they do care, and they care about their patients so much. Just something as simple as folding like putting the pads underneath the patient, which way the draw sheets to pull a patient up in bed. The folded part, the frilly part is supposed to go away from the patient, and the folded part is supposed to go up towards the body or towards the head. Something as simple as that, because if you have a code or you have an emergency situation, it's very important to be able to grab that sheet and pull that patient up the way you need them be positioned in bed. So, and then other things is like with the BP cuff, if you're taking a blood pressure cuff, make sure you put and their oxygen is already low, make sure you put the probe or the pulse ox on the opposite hand or arm, finger if you can. And they teach me routine. Routine is a point. Everybody have their own setup, their routine, which is very important. And that's another thing I've learned from them. Have your stuff set up, and like even from bed baths, like you said, it's just having your towels, your washcloths, everything set up, and it makes everything a lot faster and smoother. So be prepared before you go in the room.
That's true.
That's one big thing I learned. Just little things like that, and which is very important. I've learned a lot.
All right, Tiff, I want to thank you for joining me and viewers at home for helping us out with getting a better understanding of being a PCA and what it really is like in the hospital, and how much nurses really rely on their care and their experience to really bring home the patient care and the patient experience to be the best that it can be.
And I want to thank you as well. And I want to say this before we leave. I really do look up to my nurses, and I believe you can't have one without the other. It takes a team, and we also have really awesome nurses and really awesome PCAs as well. So it's all about teamwork. So
thank you.
I want to thank you guys for everything that you do as well.
Thank you. I want to thank you for watching, and if you enjoyed this video, go ahead and hit that like button down below. Subscribe and hit that notification bell if you want to see more about my nursing journey and any interdisciplinary care like we had today. Leave me a comment down below if there's anything you want me to go through. I post every Friday for nursing. Thanks for watching, and see y'all later.